Another day, another video of first aid by fever, chills and body aches, symptoms, diagnosis, treatment and prevention. Fever, chills and body aches are common symptoms that can indicate a variety of medical conditions. While some people may be familiar with these symptoms, others may not know what they mean or how to address them. In this video, we will explore the causes and treatments for fever, chills, and body aches, as well as how to determine if you should seek medical help. We will also discuss how to prevent and reduce the severity of these symptoms. What are fever, chills, and body aches? Fever, chills, and body aches are symptoms of many illnesses. They are the body's way of telling you that something is wrong. Fever chills are when your body temperature rises above normal. You may experience shivering, sweating, and feeling cold even though the room is warm. Body aches are when you experience pain in your muscles, joints, and bones. This can be caused by an infection, strain from exercise, or an illness. It is important to see a doctor if these symptoms persist, as they can be a sign of something more serious. Causes of fever, chills, and body aches. Fever, chills, and body aches can be caused by a variety of illnesses, from the common cold to more serious illnesses such as influenza or even a bacterial infection. A fever is an indication that your body is trying to fight off a virus or infection and is producing more heat to help kill it off. Chills occur when the body produces too much heat, resulting in a cold feeling. Body aches can be caused by a number of things, including muscle strain, dehydration, or even an infection. It is important to consult with a doctor if you experience any of these symptoms to determine the cause and prevent further complications. Symptoms of fever, chills, and body aches. Chills. Fever, chills, and body aches are common symptoms of many illnesses and infections, and can range from mild to severe. Chills are usually accompanied by a feeling of coldness and shivering, even when the temperature of the surrounding environment is warm. Aches can affect any part of the body including the back, neck, and joints, and can range from mild discomfort to debilitating pain. These symptoms, along with an elevated temperature, can indicate the presence of a serious infection, and it is important to seek medical attention as soon as possible. Fever. Fever is a medical condition that is characterized by an elevation in body temperature. Symptoms of fever, such as chills and body aches, can be uncomfortable and indicate that the body is fighting off an infection. Chills can cause shivering and goosebumps, while body aches can cause pain and tenderness in the joints and muscles. In addition to fever, other symptoms of an infection may include fatigue, headache, loss of appetite, and a sore throat. If a fever persists or is accompanied by other severe symptoms, it is important to seek medical attention. Aches. Fever, chills, and body aches can be indicative of a variety of illnesses, from the common cold to the flu. When accompanied by a fever, chills, and body aches, it is important to seek medical attention to determine the cause. Fever is the body's natural response to illness and can cause a person to feel weak and tired. Chills are an involuntary response to the body's attempt to increase its temperature, and can cause a person to shiver or shake. Body aches, or myalgia, can be caused by a variety of illnesses and can range from mild to severe. Severe body aches can make it difficult to perform even basic tasks. Treatment for a fever, chills, and body aches depends on the underlying cause, so it is important to seek medical attention to determine the best course of action. Diagnosis of fever, chills, and body aches. Physical exam. The patient was diagnosed with fever, chills, and body aches after undergoing a physical exam. During the exam, the patient's temperature was found to be elevated, and they reported experiencing chills and body aches. Upon further examination, the doctor noted that the patient had a fever and determined that they had an infection. The doctor prescribed antibiotics to help fight the infection and suggested that the patient rest and drink plenty of fluids. The doctor also instructed the patient to follow up with their regular doctor if the symptoms were not resolved within a few days. Lab tests. Diagnosis of fever, chills, and body aches can be done through lab tests. Blood tests, urine tests, and sputum tests are common tests used to diagnose the condition. Blood tests can measure the white blood cell count, while urine tests can detect a bacterial or viral infection. Sputum tests are often used to detect the presence of viruses or bacteria. Depending on the results of the lab tests, further tests may be needed to confirm the diagnosis, including chest X-rays or CT scans. Other tests, such as spinal taps, may also be performed to obtain more information about the cause of the fever, chills, and body aches. Treatment for the condition will depend on the underlying cause and may include antibiotics, antiviral medications, or other treatments. Treatment of fever, chills, and body aches. Home remedies. Treating fever, chills, and body aches can be done at home with a number of different remedies. One of the most popular methods is to take over-the-counter medications such as ibuprofen or acetaminophen. Additionally, drinking plenty of fluids and getting plenty of rest can help to reduce fever. Taking a warm bath or shower can also help ease body aches. Herbal teas such as chamomile or ginger can help soothe a sore throat and reduce fever. It is important to remember that if symptoms worsen, to seek medical attention. Medications. Fever, chills, and body aches can be symptoms of many illnesses, so it is important to speak to a doctor before taking any medication. However, there are a few medications that may help with these symptoms. Over-the-counter pain relievers such as ibuprofen or acetaminophen can be used to reduce fever, chills, and body aches. Decongestants can also be used to reduce the amount of mucus in the airways, which can help reduce fever and body aches. Additionally, antihistamines can help reduce fever and chills due to allergies or the common cold. It is important to follow the instructions on the packaging and speak to a doctor before taking any medications. Prevention of fever, chills, and body aches. Vaccination. Vaccination is an important way to help prevent fever, chills, and body aches. Vaccines work by introducing a small amount of a weakened or inactive form of a virus or bacteria into the body, which triggers an immune response. This response helps the body create antibodies that can protect it from future infections. Vaccines are available for many different illnesses, including those that cause fever, chills, and body aches. Receiving the appropriate vaccine can help to protect you from these illnesses and the consequences that can occur as a result. Additionally, it can help to reduce the spread of the virus or bacteria to others, as those who are vaccinated are less likely to become infected and then pass the virus or bacteria on. Hygiene. Good hygiene is one of the best ways to prevent fever, chills, and body aches. It is important to wash your hands often with soap and water for at least 20 seconds to help reduce the spread of germs that can lead to these symptoms. It is also important to avoid touching your face, as this can spread germs to your eyes, nose, and mouth, which can lead to an infection. Additionally, it is important to keep your environment clean by regularly cleaning and disinfecting surfaces that are frequently touched. Finally, it is important to get adequate rest and exercise and to eat a healthy diet to help keep your immune system strong and better protect you from illnesses that can lead to fever, chills, and body aches. In conclusion, fever, chills, and body aches are common symptoms of many illnesses. Although they may be uncomfortable and even painful, they are usually the body's way of fighting off an infection. If you experience any of these symptoms, you should contact your healthcare provider to get an accurate diagnosis and treatment plan. Thanks for watching.